We're talking to Shirley. Good morning, Shirley.
Hello.
Hi, Shirley. How are you?
I'm doing pretty good, thank you. And thank you for being there. You do such great work.
Oh, thank you so much.
I have a daughter who's going to the doctor on Monday, and she thinks she has a thyroid problem, and I do too. And I told her she needs something beyond the TSH, but I didn't remember exactly what she's supposed to ask for.
Oh, good question. And everybody, that's the problem. They're going to go to the doctor, and the doctor's going to do a TSH test and say, oh, I'm sorry, your TSH is fine. And the TSH is an insignificant test that has nothing to do with how a person feels or how actually the thyroid is moving. So what she's going to want to take is ask them to get a thyroid profile that includes a free, that's FREE T4, and a free T3. Now, here's what happens in a lot of people's thyroid, and this is what endocrinologists are not looking at. Your thyroid gland produces a compound called T4, and that's 4 iodine molecules or 4 iodine atoms that are attached to a tyrosine amino acid. That's the T. The problem with iodine is that when you look at the periodic table of elements, you're going to see in the same line chlorine and fluoride and bromide, and that's going to take the place. It's actually going to displace the iodine, and fluoride is above iodine on the periodic table, and so is chlorine. So all of these displace the iodine. So instead of the tyrosine having 4 atoms of iodine, the tyrosine has 4 atoms of fluoride. So when the blood test is done, the T4 is going to be in the normal range, and the TSH is going to be in the normal range. Now, what happens is then the body sends that T4 to the liver, also a little in the kidney and a little in the periphery, but mainly in the liver, that one of the atoms of iodine is supposed to be taken off, and it becomes T3. And the T3 is what goes to the cells of the body. And again, what happens is because there's no iodine in the body's using the fluoride or the chlorine atom, attaching it to the tyrosine. So it becomes T3 based on fluoride again. And so that the thyroid never functions properly, except that the all of the blood tests come in normal. So what you want is free T4, free T3, and then some people will do an iodine challenge test, but that's a difficult test to do. So what we do is we know that 99% of the population of the United States is deficient in iodine, and so you build up slowly to about 25 to 50 milligrams of iodine, not micrograms, and you slowly, it takes about a year to push out the fluoride out of the body and the bromide and the chlorine. So we tell people, stop drinking chlorinated water, stop taking chlorinated showers, and stop eating regular bread products, because all of your bakery goods, bromide is used as the preservative. So this is why thyroids are not working. We tell people, do not use the blood test for your thyroid, because it doesn't always work. What you want to know is, as an example, and again, the blood test with the free T4 and the free T3, that's important. But if you have a lot of thinning hair, especially by your eyebrows, if your skin is dry or you have eczema or psoriasis, one of the ways you can really tell is that you look at your tongue. You stick your tongue out and look at the mirror. And if it's scalloped, you'll see little scalloping on the edges of the tongue, and that's caused because of the edema, the swelling of the tongue. What happens, that's called mucin. and the tongue and the whole body, especially the skin, you'll see it fills up with a compound called mucin. And so that you'll see that. Also, the thyroid can get enlarged. You can end up with nodules. You can have a slow heart rate. You'll have low blood pressure. You'll have yellow skin if you eat too much beta-carotene. And you get little bumps on the backs of your arms. Okay, they're little teeny. If you scratch the back of your arm, the upper arm, and you feel these little teeny bumps, and they almost scratch like a little waxy stuff coming off, that's the carotene that gets embedded under the skin because of the thyroid not working. There's also maxilloderma, which is a pitting and non-pitting edema. So all of these are symptoms of thyroid, and that's the important. If their temperature is always low, it's low thyroid, and if the thyroid tests are coming out normal, it's because the body's replaced iodine with either fluoride, chlorine, or bromide. How was that? Was that too much on thyroid?
That was great. Thank you so much.
Thank you, Shirley. I hope everybody gets that and understands it now, why when they go to their doctor, that aspect on thyroid is not always accurate. And so you go by the symptoms that your body is having, and that's what we go by. As an example, if you have fibromyalgia, that is a 100% low thyroid. Every doctor in the world knew that before 1973. It was generalized muscle aches and pains. So if your doctor's treating you with pain meds and anti-inflammatories, it's because he wants to keep your thyroid unhealthy. So it's terrible. This is what happens. Anyway, thank you so much. There's our music. We'll be right back. This is Eliezer Ben Joseph, right back with Natural Solutions.